I'm Dr. John Kruse, and today I'm going to be talking about ADHD and fatigue. So the take-home message is that high energy is one of the most commonly endorsed superpowers or beneficial effects of ADHD, and yet at the same time, a disproportionately high number of people with ADHD endorse the feeling of feeling fatigued all the time. So how do we reconcile apparently high energy and low fatigue versus people with ADHD really having high fatigue and low energy? So an important point to make is that fatigue also has other names, exhaustion, tiredness, has significant overlap with sleepiness, sedation, drowsiness, but these are two separable qualities or entities or conditions. Again, considerable overlap, and I'm going to be trying to talk primarily about fatigue today. The simplest definition is that it's not having the energy or perceiving you don't have the energy to achieve what your body was previously capable of, either with physical exertion or mental exertion. And the concept of fatigue has been primarily broken down into two big categories, and one is peripheral, so that's problems with the muscles and nerves themselves, and central, meaning it's coming down from the brain area, but both of them can contribute to, again, the feeling and perception of not being able to do what you could previously do exertion-wise. And the vast oversimplification is that although we're identifying brain areas that are important in fatigue, at the neurochemical level, it seems that fatigue represents a balance or an imbalance between overly high levels of serotonin, tryptophan, and overly low levels of catecholamines, which are norepinephrine and dopamine. And it makes sense given that there's a wealth of evidence and emphasis that there are insufficient dopamine and noradrenergic activation in ADHD. That might make sense why the imbalance would push many people with ADHD, a larger percent of the time, into the fatigue state. Several studies that have looked at clinical fatigue rising to clinical, so impairing levels, have found, again, disproportionate percentage of people with ADHD. One study found that 62% of people with ADHD, compared to a much lower, less than 20% of people, healthy controls, had impairing or interfering levels of clinical chronic fatigue. Fatigue in ADHD is most closely linked to inattentive symptoms rather than hyperactive or impulsive symptoms, but given that inattentive plus combined type, it includes the vast majority, so less than 10% in almost every study suggests people with ADHD only have hyperactive and impulsive type. So some amount of inattentiveness is present in more than 90% of people with ADHD. And again, fatigue tends to track or correlate with having inattentive symptoms. Again, fatigue is not just something specific to ADHD. So when a range of psychiatric conditions, disorders have been assessed, sleep disturbance and fatigue are common in almost all of them. The one notable exception is OCD doesn't tend to have a particular association with fatigue. Almost all the other major mental health issues do. And again, these effects in studies can be shown to be separable effects. So sleep is primarily determined by two different factors. One is a circadian rhythm, a clock effect, but the second is a fatigue factor. So the longer the time you've been awake, the longer time since the last sleep, and the more exertion you've been doing drives the sleep factor. That's to some extent in a buildup of adenosine. Whereas again, fatigue, exhaustion, tiredness has much more to do with not being able to achieve with your body or your brain what was in your range of achievable efforts before, and secondarily that can lead to lower motivation to even trying to do anything. And it's been observed that there are gender differences in the propensity to fatigue. Certainly being an aroused, overdriven fight or flight state tends to lessen fatigue. If you've been fatigued, but you're suddenly scared and you have to run or get the hell out of there to save your life, fatigue may be momentarily out the window and forgotten. And certain other factors like sleep deprivation, general physical poor health make fatigue much more likely. There are certainly physical conditions that are particularly associated with fatigue. And there are aspects of self-perception. So perceiving yourself to be fatigued tends to have a feedback loop cycle that makes you less willing to try things. Over time, you're less likely to stay in shape, and you are less able to do things. That may be particularly heightened in some individuals with ADHD. So the connection between fatigue and ADHD at three very simplistic levels. One is suggests that a variety of studies indicate that people with ADHD are using more of their brain more of the time. And we know the brain is disproportionately a big burner of energy. So something like 2% of our body mass and 25% of our energy, oxygen consumption, ATP consumption is consumed by the brain. If people with ADHD are using more of their brain more often, not using it efficiently, that in itself could lead to greater fatigue, greater exhaustion. Another theory is that either due to poor interoception, and I have a talk on that, or poor hyperfocus, and I have a talk on that in this series on this channel, either being less aware of what your body's doing or being so engaged in the moment may make it more likely that people with ADHD often exceed their limits physically or mentally. And that also could be a contributor to being greater exhausted, more prone to exhaustion. Again, these levels are not mutually exclusive. Or it could be that people with ADHD are more at risk for fatigue, even if they did the same amount of activity, mentally or physically, just because their brains are wired more in a different way and or their chemistry is different, so they are more vulnerable. So an example, again, is that dopamine and norepinephrine, at least in the short run, tend to rescue people from fatigue. If you are, again, gross oversimplification, low in dopamine, low in norepinephrine, you're less likely to be rescued from, or you're more likely to fall into a fatigue state. And one other sort of general warning or caveat is that most of the studies on individuals with ADHD, they ask them to conduct a certain task and then look at brain activation. This may be a highly artificial situation for anyone, but it may be particularly artificial for people with ADHD. And certainly if you look at the data regarding executive function tests, that many people characterize ADHD as basically a problem of executive functions, how the brain processes and controls the flow of information going in and out and manages emotions as well as cognitive aspects. But on the substantial majority of tests looking at executive function and people with ADHD finds a score within the normal range. Well, part of that is that rather than watching them free range people with ADHD in the real world, you're putting them in a lab situation, you're removing distractions, you're providing structure so they stay on task. It may not be surprising that it's harder to find some of the executive function deficits in that situation, but then similarly, evaluation of fatigue or tasks that are fatiguing may not be what the real life experience of people with ADHD are showing. So jumping into it, I've mentioned that there's a difference between peripheral and central fatigue, and I'll talk first about peripheral fatigue. So this is muscular tiredness from overexerting yourself. Components of it aren't just tiredness and weakness, but soreness. There can even be twitching or cramping or abnormal contraction of muscle fibers. And fatigue can be objectively tested or measured by just stimulating nerves both before and after an highly exerting event or set of exercise. And if you give the same electrical stimulation and you get a weaker muscle contraction or response, less force, less power, then you're seeing fatigue in action. You are seeing that the muscle is not responding as well as thoroughly. That's, again, peripheral because it's suggesting it's at the level of the muscle, not it's demonstrating it's at the level of the muscle or maybe the neuromuscular junction. And aspects of calcium influx, oxygen consumption, ATP, the energy molecule being consumed, the acidity, the temperature. All of these are involved in generating fatigue at the muscular peripheral level. Lactate accumulation is a good marker or correlate of level of fatigue. And chronic fatigue or ongoing fatigue we know is associated with not just feeling tired, but actually oxidative stress, damage to muscle tissue, and inflammation. And again, both oxidative factors and inflammatory markers don't usually just stick in the organ that they originated, but can have effects throughout the body, including the brain. And with just purely peripheral muscle fatigue, we know that some of the drugs that are thought primarily to be working within the brain, things like amphetamine and modafinil, measurably help in studies with peripheral fatigue. So why peripheral fatigue may be important with ADHD, again, is that people with ADHD may be less adept at judging when they've overexerted themselves. They may be more prone to getting into those situations and therefore more likely to cause peripheral fatigue. And there's clearly an interaction between peripheral fatigue and central fatigue. So central fatigue, on the other hand, is when the inability to exert yourself to the level that you were previously is due primarily not to what's happening at the muscle level, but what's going on in the brain. And central fatigue can be measured by both self-report questionnaires. There's a number of validated ways of assessing that. And there are also objective ways. And similarly with the peripheral stimulation or peripheral fatigue, stimulating a nerve, and if you get, and checking what kind of response you get from the body and how strong the contraction. And if you get a weaker response, so it's actually asking someone to voluntarily do a certain contract a muscle and then electrically stimulating that same nerve. And if you get a better, larger response out of the electrical direct stimulation than you get from the person voluntarily, volitionally trying to stimulate that muscle, then that's actually a demonstration of fatigue. So it's almost the reverse response to peripheral. Here, you're getting a bigger response from stimulating the nerve than the person can generate voluntarily. So the brain, something in the brain is sending a smaller signal down that nerve than the nerve is actually able to convey or carry. We know factors that affect central fatigue include sleep. If you're sleep deprived, mood can affect it, motivation, anxiety are all factors muddying the waters. There are a few individuals studying specifically fatigue and inattentive ADHD, and probably the most prolific in this area is, and I hope I don't butcher his name too badly, Takanobu Yamamoto, who's a psychologist at the Tezukayama University in Japan. His description of where research has progressed in studying fatigue, both in central fatigue, both in general, but specifically in inattentive ADHD, is that initially or for years, people focused on serotonin, that there's clearly a correlation between serotonin buildup and the degree of fatigue people express or say they are experiencing. We know that with muscle action, prolonged muscle action, the more people exercise, the more they increase, or what's broken down are free fatty acids. Those are present in the blood. The higher your free fatty acid blood level rises, that actually displaces tryptophan, an amino acid, from albumin, a protein that's carrying it around in the blood. That means there's more free tryptophan floating around. More free tryptophan in the brain equates with more being in the blood, translates with more of it being converted or transported into the brain. And again, tryptophan is the precursor, just two little chemical steps, convert tryptophan into 5-hydroxytryptophan and then 5-hydroxytryptamine. 5-hydroxytryptamine is serotonin. And again, serotonin levels correlated with fatigue. So for years, much of the interest and focus was on serotonin itself. More recently, there's good evidence that tryptophan itself, even though we think of it as an amino acid and not a neurotransmitter, may well be a neuromodulator. And to put some of this in perspective, when tryptophan is converted into serotonin, that's only about 5% of the tryptophan gets converted into serotonin. 95% of it is converted into kynurenic acid. There's much more available tryptophan in the brain to be acting on different receptor systems. And studies looking for correlations and associations find that kynurenic acid it's also strongly correlated with the level of fatigue someone is experiencing. And kynurenic acid is an NMDA glutamate receptor activating neurotransmitter. So it's a blocker of glutamate at the NMDA receptors, and that's also associated blocking MDA with fatigue. And there are some evidence, not a lot of studies, but some showing that giving people a huge increase in their intake of tryptophan, boosting tryptophan levels in the frontal and parietal circuits, is correlated again with decreased activation in those circuits and an increased feeling of fatigue during attentional tasks. And in rat models of chronic fatigue, inattentive symptoms are correlated with elevated tryptophan and kynurine, but not actually with serotonin. And those are elevated levels of tryptophan and kynurine in neurons and in oligodendrocyte, so glial cells that support the neurons. Both serotonin and or tryptophan being too high and dopamine levels being too low are strongly correlated at the biochemical level with the subjective feelings of fatigue. Now, at the anatomical level, certain cortical areas that are associated, so prefrontal cortical areas and other parts of the cortex that are associated with attention, cognitive control, motor processing, all of those show decreased activity when someone is reporting they're experiencing fatigue, or when you subject them to tasks which we know are consistently associated with fatigue. There's also decreased activation in areas, the middle frontal cortex, anterior cingulate, and other areas that are not just associated with attention cognition, but with motivation. So fatigue, it makes sense that part of that you're less motivated if motivation centers are less activated. And areas that are actually increased in activation during experiences of fatigue seem to be substantial parts of the default mode network. And again, that's the system or network of the brain that's active when you tell people in an MRI machine to just do nothing but daydream. We know that default mode network seems to be overly active in many people with ADHD, and the default mode network has at least some reciprocal inhibitory action with some of the salience and activity-focused brain networks. So default mode network is on, you're daydreaming, inattentive, and less able to engage in specific tasks. And again, that default mode network is associated with fatigue. A recent study in the last year that got some fair amount of attention by a Hungarian group, and I cannot pronounce any of their names, sorry, looked at what leads to individual variability in experiences of fatigue. This was done in people with ADHD or other mental health conditions, but they found that there were certain areas, particularly the precuneus, so having a thinner cortical area in the precuneus, so fewer cells there, was strongly correlated with having or experiencing more fatigue on tasks. There were other areas they also found in the cortex that were also associated three other areas. But the precuneus is particularly interesting because previous studies have shown that kids with ADHD have a precuneus that is smaller or shrunken, or again, may predispose them to fatigue, and also that the precuneus, which is part of the default mode network, is more extensively connected with other areas than in ADHD kids. Again, all of this fits with the possibility that, again, people with ADHD may be using more of the brain more of the time and get more exhausted from it, or people with ADHD may be exceeding their limits more often and may therefore wind up in states of exhaustion more often, or all these again are likely going on. People with ADHD are more at risk for fatigue, either because of their norepinephrine dopamine relative deficits or because of some of their wiring, that some of the networks that contribute to fatigue are overly strongly wired, or because certain parts of their brain are thinner and less active. So what can we do about fatigue, or how can we tackle it, reduce it? Number one are some of the behavioral steps. So getting adequate sleep is important. You can still have fatigue even if you're sleeping well, but if you're not sleeping well, you're strongly increasing the likelihood you're going to wind up fatigued. Paradoxically, in most situations, and some of them have not every situation, so there's some evidence that forcing people with chronic fatigue syndromes to do exercise may be counterproductive and contribute even in the long run to fatigue. But for most people, if their neuromuscular system is generally intact, one of the best ways to increase tolerance to fatigue is exercise. And yes, that should be approached gradually and with attention to what your body is doing, how it's responding. And again, this represents an area of vulnerability for those with ADHD because they have a greater tendency to jump in with both feet and limbs and whole body and overexert themselves rather than taking it at a gradual level. Many of the medications used for the cognitive aspects of ADHD for focus attention have also been demonstrated in both people with ADHD and a variety of fatigue-inducing states. So in multiple sclerosis, in cancer-based fatigue, in brain fog associated and fatigue associated with chronic COVID, with chronic fatigue, myelitis syndromes. So in all of those, there's some evidence and wide use among many clinics that low doses of stimulants are effective at decreasing fatigue. It's thought that primarily these are actions through dopamine 2 receptors and alpha 2A noradrenergic receptors. We know also that non-stimulants that boost norepinephrine and dopamine, Wellbutrin, Eczema, also can be effective specifically with fatigue. Amantadine has been studied in a number of different fatigue situations and found to be helpful. Modafinil, which some research suggests may be dopamine boosting, but may also be more strongly working on orexin systems, has been found to help with fatigue in a number of different situations. The Japanese researcher who studies specifically inattentive ADHD is a big advocate and is busy trying to collect more data on branched-chain amino acid supplementation. So the branched-chain amino acids, leucine, isoleucine, valine, compete with tryptophan for entry into the brain. They're all transported into the brain across the blood-brain barrier by the L-system amino acid transferase type 1. So if you give people big, and big is large, so 10 to 20 grams a day, most of our biochemical interventions are on the milligram level. These are big doses, but these are amino acids that are essential for building proteins in your body. They're, you're getting some of them every day or you would not be alive. And they've not been associated even in this range of up to 10, 20 milligrams a day with adverse serious side effects. Anyway, boosting these branched-chain amino acids means that they wind up competing with tryptophan. Less tryptophan gets into the brain, and again, there's some moderately good evidence that tryptophan and kynurenic acid, which it breaks down into, as well as serotonin, are associated with fatigue. So there's some more looking at peripheral fatigue and physical motor actions rather than the central component. There is evidence that branched-chain amino acids can reduce physical fatigue and improve cognition, so decrease mental fatigue without it happening by a mood-boosting effect. So it's not just these are happy pills, because again, it's hard to separate out motivation, mood states from fatigue. So the take-home message is, take care of your body by getting rest and nourishing it well and getting sufficient exercise. And many of the traditional ADHD medications, I'd say one notable exception is guanfacine. One of its commonest side effects is fatigue. So that's not going to be one that's terribly likely to diminish fatigue. And there will maybe healthy supplements. People have looked at other things, but the branched chain amino acids so far seems to have some of the scanty but best physical evidence that may help with fatigue, specifically in ADHD. So I do see that there's a few questions. Why aren't traits like disordered verbal fluency, storytelling present in the DSM? There's lots of focus on behavioral symptoms, but few on the cognitive adult impairments that ADHD produces. I mean, one is, and I've talked about this, and I don't usually, I've written probably more about it than I've talked on my blog post on medium.com. Part of the thrust of DSM in recent versions has been to avoid any direct theoretical psychoanalytic or other approaches to psychopathology, because we still don't know why or what causes most mental health conditions. And consequently, it was to focus on as measures that are as objective and measurable as we can, and behaviors tend to be easier to measure and categorize than more complex traits like storytelling or verbal fluency. So if you ask, I mean, again, most of the DSM is oriented towards clinical evaluations, that it's certainly used as a research tool for determining someone meets a criteria or diagnosis for a certain test. But asking clinicians to evaluate verbal fluency is introducing such a huge subjective element. I mean, one is most of them aren't trained in that, or storytelling ability. So I mean, at a different level, one of the biggest objections to the DSM criteria for ADHD is, yes, it addresses behavior. It doesn't address at all emotional regulation, which many studies show that at least 2/3 of people with impulsive hyperactive ADHD are showing as well problems with emotional regulation or control, and that many of the treatments help the cognitive attentional aspects of ADHD also help those elements of ADHD. Art 2 Productions asks 9 to 10 hours of sleep. So most of the sleep research suggests that most humans really do need somewhere between 7.5 to 8.5 hours. It's not just a correlation, which it's a strong correlation that people perform better in that if they've gotten that range. But if you deprive people of sleep, in a recent, I saw two conflicting studies, not actually conflicting. One is that I think it was something like 62% of Americans, adult Americans, were endorsing getting 6 hours or less of sleep a night. That's clearly insufficient. Another one showed that I think during the COVID years, 2019 to 2022, there was on average a 10-minute increase in the duration of sleep. That doesn't erase the magnitude of the deficit. It's moving in the right direction, though. So the studies uniformly show that people who are sleeping less than 7.5 to 8.5 hours are performing more poorly on a whole range of extremely simple, basic cognitive tests. So even if they can't perceive that there are decrements in their performance, almost certainly there are. When people are sleeping more than that, I mean, one is it's sometimes reflecting sleep inefficiency, that they are in bed trying to sleep a greater amount of, for most of that time, but they're not actually asleep at that amount of the time. Someone who is truly sleeping that many hours or needing that, it does suggest that a more extensive workup should be done to try to evaluate if there's some other physical, including brain problem going on, that they require that for sleep. Sleep disturbances, as I mentioned briefly at the beginning of this, are common with almost every mental health condition and very strongly correlated with ADHD. But ADHD, the strongest correlations are they're getting less than sufficient sleep and a phase delay, so it's harder falling asleep later, hard to wake up earlier, morning people. T. Coate, again, I may not be pronouncing that right, says, I've always wondered why I require so much sleep. I'm 42 and held myself back from promotions because of the off and on horrible fatigue and brain fog. So one other is, as we're talking about sleep, that far and away the most common problem sleep clinics deal with, and certainly a common prevalent condition is sleep apnea. That is far more common as we age and is more common when people are overweight, but certainly there are young, healthy people who have it. There's children who have it. And many of the symptoms of chronic sleep deprivation from sleep apnea are overlap, I'd say, perfectly with ADHD. Or what I'd say is you can induce officially it isn't ADHD because the definition of ADHD requires that it's not caused by another medical or physical condition, but sleep apnea doesn't always have to, create exactly an ADHD picture. It also mentions that his concern is that his 14-year-old son is very similar with his energy level, okay at times, but barely hanging on most days. So, again, trying to get, and one of my big pet peeves is how often we focus on just the amount of sleep, but it's every bit as important. Every bit, not just secondary or somewhat important. Getting the same hours of sleep each night as is important as getting the duration of sleep. So if you're used to or accustomed to sleeping about from midnight to 8 a.m., but you stay up till 4 a.m. and sleep till noon, that sleep is not as restful, not as restorative. You're not likely engaging the garbage system of the brain that sweeps out debris during nighttime hours. Not just nighttime, sleeping and nighttime hours. So I would usually start with trying to make sure you're getting sufficient and consistent sleep, and then look at other, again, that sounds counterintuitive, but exercise is one of the most effective ways to increase energy or decrease fatigue over time, but it's a gradual approach. And it may be worth investigating either sleep study and or more general metabolic and biological medical workup. Mr. AKA 1996 asked, any clinical experience with Mydayis? Yeah, so I use Mydayis with some patients. It's a form of a slow-release, long-acting form of amphetamine. I wind up using Vyvanse more often. So Mydayis is designed to and does in real life last a little longer than Vyvanse. So for many people, Mydayis is functionally lasting almost the entire 16-hour waking period. For many people, that's great and desirable. I've had some where it just lasted too long, and particularly many people with ADHD are less alert, less with it in the morning, and therefore more prone to miss the window of opportunity. So you have a smaller window of opportunity where you need to take it or it will be keeping you up at night. But I have some people who love it and it works better for them than Vyvanse does. I did just learn this week that Mydayis had gone, that there are now generic versions. I only had one person who's been on the generic versions. He wasn't able to detect any difference between the brand name, but that's a pretty small sample size. Cosmos's Princess asks, do I recommend a person with ADHD quit drinking coffee to combat fatigue without using, so should they avoid caffeine as a way of dealing with fatigue? So I do have a talk on caffeine on this channel. Most of the ADHD topics, my experience is that most of the experts are pretty unanimously on one side, and very few have an opposing view. Caffeine is one where I'd say it's close to 50-50. So half the experts, I guess I get to conclude myself as an expert these days, half of them say caffeine is a lousy stimulant that has actually higher risk of cardiac effects, of anxiety, of sleep disruption for an equivalent alerting effect compared to a prescription stimulant. So although it's not controlled, it's in some level safer. If you're using it in equivalent alerting dose, it's probably a less safe stimulant. And those experts would say, absolutely eliminate it. It's a lousy stimulant. And one other thing is that you may not even know what dose you're getting, even if you're buying the same drink every day at the same store from the same big brand coffee maker. They, in general, are not controlling well for caffeine intake or caffeine content. And again, most of the sleep experts think it's particularly bad since it's interrupting with that adenosine fatigue signal to the brain in terms of when you should sleep. The other half of them say it's widely available. It's a part of many people's habits. It's something pleasurable. As long as they are aware of its interacting in specifically other stimulants, then as long as you try to keep it fairly constant, it may be reasonable to continue with, and it may help them get away with a slightly lower dose of a prescription stimulant. Clearly, if you've seen specific associations where it's not good for you or not your friend, except for, helping you power through a late night report that you have to write up because you didn't do it 2 weeks ago, if you see that it's not working well or causing problems for you, then I would stay away from it. But for many people in moderate doses, it's probably one of the less harmful habits people have in life. So now I'm signing off for real. So stay healthy, stay happy,